Hello, and welcome to Westgate Resorts 2018 Annual Enrollment. Westgate Resorts is committed to offering quality plans and a well-rounded benefits package to their team members now and in the future. This is the time of year to review your benefits and select the plans that work best for you and your family. If you have any questions, please email them to benefits@wgresorts.com or contact your local team member services. So, let's get started. In this presentation, we will be covering an overview for open enrollment, Westgate's wellness program, what's new, effective June 1st, 2018, the benefits and plans offered, and how to enroll online with OneSource, along with important reminders and next steps for you. Annual enrollment for Westgate Resorts is from April 30th through May 13th, 2018. Online enrollment is done through OneSource. All team members are required to access this system. Annual enrollment is the one time each year you have the opportunity to add, drop, or change your benefits coverage. Your elections will become effective June 1st, 2018, and will remain in effect until May 31st, 2019, unless you experience a qualified life event such as marriage, birth of a child, etc. If you experience a qualified life event during the year, you must notify TMS within 30 days from the date of the event, and you must log on to OneSource to change your benefits. Otherwise, you will be unable to make a change to your benefits until the next annual enrollment period. New full-time team members become eligible for benefits the first of the month following 60 days of employment. There is a spousal surcharge. If a covered spouse can purchase medical insurance from their employer, a surcharge will be added to your premium. You must log on to OneSource to answer the question about your spouse's alternative medical insurance coverage each year or when there is a change. Deductible and out-of-pocket maximums are on a plan year from June 1st, 2018 to May 31st, 2019. Westgate Resorts continues to offer full-time team members working 30 hours or more per week the benefits listed below: medical, dental, vision, health care and dependent care FSAs, voluntary mail-order prescription programs through WG Meds, basic life and accidental death and dismemberment, voluntary life and AD&D for team members, spouse, and children, voluntary short-term disability, core long-term disability when enrolled in a medical plan, and buy-up long-term disability, a voluntary accident plan, a voluntary critical illness plan, My Ideal Doctor, a customer advocate center, an employee assistant program. If you would like to cover your spouse under any of the plans, you are required to provide a copy of a government-issued marriage certificate. Birth certificates are required for each dependent you are covering up to age 26. If you do not submit the required documentation for your spouse and dependents to Human Resources within 30 days of their effective date, they will not be covered. Westgate Wellness is committed to helping you achieve your best health. We have partnered with UMR to provide a comprehensive health and wellness program. Our wellness program provides personalized awareness, education, and coaching to all medical insurance participants, both to the team members and their covered spouses, on our group medical plans. Participation in wellness requires you and your covered spouse to complete a clinical health risk assessment, participate in biometric screenings. If a team member and or their covered spouse did not complete both of the above requirements, the higher non-wellness rates will be assessed beginning June 1st, 2018. If a team member and or their covered spouse tested positive for tobacco nicotine or did not complete the tobacco nicotine test, the higher non-wellness rates will be assessed beginning June 1st, 2018. Additionally, if the team member tested negative for tobacco nicotine but did not answer the tobacco affidavit question online at benefits.plansource.com, the higher non-wellness rates will be assessed beginning June 1st. New hires and newly enrolling team members have 30 days following their effective date to complete the wellness materials. Westgate Resorts provides wellness participation incentives as shown in the chart below. If you do not meet the requirements to earn a reward for a biometric screening target, you may complete health coaching and 3 action plans by December 31st, 2018 to earn your rewards, as the program's reasonable alternative. Please allow a minimum of 4 months to complete these steps. Contact UMR at 800-207-7680, and they will work with you and, if you wish, your doctor to find a wellness program with the same reward that is right for you in light of your health status. Cash incentives will be processed through payroll on a semi-annual basis this year. Please allow 6 to 8 weeks after the completion of your annual physical to allow verification from UNR for processing. The payout dates are listed here. If you elect medical coverage, you will be required to acknowledge the tobacco affidavit question during your online enrollment each year. Team members enrolled in a medical plan that do not answer the online question will be assessed the higher non-wellness premiums beginning June 1st. The minimum medical plan is available to all team members and will offer the lowest premiums and per pay period deductions of all the medical plans offered. When electing this plan, be sure you are aware of the deductible of $3,500 per year per individual and $7,000 per family, which will need to be met prior to UMR paying any portion of your eligible services. After you have met your deductible, you will be responsible for 30% of eligible charges up to your total out-of-pocket maximum of $6,350 per individual and $12,700 per family. Once you have met your total out-of-pocket maximum, UNR will pay eligible charges at 100%. As highlighted in yellow and part of all medical plans offered, preventative care is covered at 100% as mandated by HCR. Preventive care services are such things as annual physicals, well women annual exams, mammograms, immunizations, colorectal cancer screenings, and well child care. Members on all medical plans using specialty medications will go through the Optum Rx Specialty Pharmacy Program. Specialty medications are those that may require ongoing clinical oversight and education for best management. They may have unique storage or shipping requirements, or may not be available at retail pharmacies. This program provides the resources and personalized, condition-specific support needed to help better manage the condition. The base plan offers slightly better coverage than the minimum plan since you have copays for services without having to meet a deductible first. The copays are as listed: for primary care visits at $40 and specialist visits at $60. The base plan has the same deductible and OOP max as the minimum, but you will only need to meet the deductible when you receive inpatient or outpatient services. The deductible is $3,500 per individual and $7,000 for family, and out-of-pocket maximums $6,350 individual, $12,700 family, but still allows participants to save money on premiums. This type of plan is ideal for families who do not use their health insurance plan very often and want to have more control on how they spend money for health care. The emergency room ER copayments will be increasing to $300 per visit in the base, HPP, and PPO plans. Over the last 12 months, 30% of the ER visits in our plans were for non-emergency situations. Urgent care facilities, walk-in retail clinics located inside your pharmacy, and your primary care doctor are far less costly than the ER and should be used for non-emergency treatments when possible. Top examples of non-emergency diagnosis that could be treated at one of these facilities instead of the ER include urinary tract infections, headaches, lower back pain, dizziness, viral infections, bronchitis, knee pain, and diarrhea. Prescriptions will have a $300 deductible for individuals and $600 for family to be met first, and then copays will apply at $10, $50, $75 for a 30-day supply. Mail order is also available for prescriptions requiring more than a 90-day supply. Also, on all medical plans, members who purchase brand name prescriptions will pay a higher copay than they would for purchasing generic drugs unless their doctor indicates that the prescription should be dispensed as written. Also, remember, WG Meds, the new voluntary program for certain brand name maintenance medications, have a $0 copay. The HPP plan provides less out-of-pocket cost when you need services, but will cost more in premiums than the minimum and base plans. When visiting a PCP, you will have a $20 copay. A specialist is $40, urgent care $50, and $200 for the emergency room. We will touch on urgent care versus emergency room further into the presentation. If, after you are seen by your PCP or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $1,500 per individual, $3,000 per family, then 30%. If you are admitted to the hospital, you will also be responsible for the deductible and 30% up to a maximum of $5,000 per individual, $10,000 per family. As previously mentioned, the emergency room ER copayments will be increasing to $300 per visit. Prescriptions are $15 for generic, $40 for brand name, $60 for non-preferred for a 30-day supply. Again, remember, WG Meds, the new voluntary program for certain brand name maintenance medications at no cost to you, a $0 copay. With the PPO plan, you have the flexibility of going in or out of network. In network, you will need to visit UMR participating physicians and hospitals. While going out of network, you can visit a physician or facility of your choice, but this will mean more out-of-pocket expense to you. In network, you will have copays for the following services: PCP, specialist, urgent care, and emergency room. If, after you are seen by your PCP or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $500 per individual, $1,000 per family, then 20%. If you are admitted to the hospital, you will also be responsible for the deductible and 20% up to a maximum out-of-pocket. For the in-network out-of-pocket maximum is $3,500 per individual or $7,000 per family. As previously mentioned, the emergency room ER copayments will be increasing to $300 per visit. Your prescription copays for a 30-day supply under this plan are $15, $35, $55. Mail order is also available. Going out of network, you will have a $1,000 individual or $2,000 family deductible with 40% coinsurance and $6,000 individual, $12,000 family OOP maximum for all services. Remember, WG Meds, the new voluntary program for certain brand name maintenance medications at no cost to you with a $0 copay. As a member, you and your family will receive 24/7 365 access to U.S. board-certified physicians who can consult, diagnose, and prescribe medication if deemed appropriate via interactive audio or video. Regardless of the time and location, you can connect with a physician for common and acute illnesses. The physician will be able to review your telemedicine record, discuss symptoms, and treatment options. Some of the benefits of My Ideal Doctor include 24/7 365 access to a physician, a callback in less than 30 minutes. You can speak to a doctor at work, while traveling, or from the comfort of your own home. Save money by avoiding expensive ER and urgent care visits. Some examples of when you use My Ideal Doctor include: you are considering going to the ER or urgent care for a non-emergent issue. You're at work, home, or on a business trip. You do not want to sit in a waiting room with other patients. Call My Ideal Doctor at the number shown here, 855-879-4332. To help manage the rising prescription drug costs, we have added a voluntary program for certain brand-named maintenance medications. The program's name is WG Meds, offered through Canna Rx, an international pharmacy program. Advantages of joining WG Meds are a $0 copay for all brand name medications offered through the program, so no out-of-pocket expense. Prescriptions can be shipped directly to your home with no shipping and handling costs. Review the enrollment form, which includes the list of brand name maintenance medications. This program is available for participants in the base, HPP, and PPO plans only. This does not replace your prescription coverage with UMR. Visit the website shown here for further details. Take charge of your weight with Real Appeal. Real Appeal is an online weight loss program available at no cost to eligible Westgate Resort team members and families enrolled in UMR medical plans. When you enroll in this program, you are offered coaching support for a full year, a kit full of tools, a scale, exercise DVDs, a food guide, and much more. Team members, spouses, dependents who are 18 years or older are all eligible. To be eligible to participate, you must have a body mass index of 19 or higher. You can get started by enrolling at www.wgresorts.realappeal.com from your smartphone, tablet, or personal computer. This slide shows the journey of the Real Appeal program with UMR. Please be aware of the expanded list of preventative health services for women. You do not need to pay a deductible, copay, or coinsurance as long as you go in-network for the services listed. Please note that this is not a complete list. Refer to the flyer within PlanSource. Additional pharmacy options that can save you money are Costco, Walmart, and Target. Team members and their families enrolled in the base, HPP, and PPO should take advantage of Costco. You do not need to be a member. You simply show your UMR ID card and will pay nothing for generic medications, or $20 for preferred, $40 for non-preferred. As a reminder, under the base plan, you will still need to meet the prescription deductible, which is $300 for an individual, $600 for a family, prior to the benefits. As noted, both Walmart and Target offer a wide range of generics for $4 for a 30-day supply or $10 for a 90-day supply. If you have a Publix or Sam's in your area, you can take advantage of their offerings as well. Free ACE inhibitors, antibiotics, and metformin. Here's how to find a provider. There are two ways. You can go to www.umr.com and select Find a Provider on the homepage. UMR works with many different networks. You will see a list of those networks, and you will scroll down the page to find your provider network, which is UHC Choice Plus. You can find the name of the provider network on your ID card. Then follow the prompts to look for a network provider in your area. Or, after registering and logging into the member portal of the website, you can just click Find a Provider, and you will automatically be directed to the correct network. Lastly, if you would rather not look on the website, you can always call UMR and a customer service rep will help you find a provider. As you know, costs for the same products and services can vary widely depending on where you go to purchase them. The same goes for medical treatments and procedures. My Healthcare Cost Estimator is an innovative tool that gives you easy access to the information you need to make informed healthcare decisions prior to having treatment. My Healthcare Cost Estimator can help you through every step of your treatment. It allows you to find treatment options and learn about recommended care. You can even create a care path to track the appointments, tests, and follow-up care related to your healthcare needs. With the Healthcare Cost Estimator tool, you can search for the specific type of service you need, compare true costs of care using real data from real doctors, see the total charge for your treatment, and know what to expect from beginning to end. With UMR's online healthcare cost estimator, you can get a personalized estimate based on your specific medical plan and the zip code where you want to look for healthcare providers. You can also earn a $25 incentive for utilizing the Health Cost Estimator. You must fully utilize My HCE Cost Transparency to earn the incentive, which is paid out quarterly. Full utilization is defined as a user logging into the My HCE solution, searching for a treatment or procedure, and reaching the final estimate page after selecting providers and facilities. My HCE is user-friendly. It's based on 4 key elements we call the 4 Ps. Procedure. Look up treatments and services specific to your needs with the easy-to-use search engine. Price. Compare estimated prices of your treatment options to make a decision that fits your budget. Provider. View quality and efficiency measurements for participating providers. Place. Locate providers in the area you choose and view maps and print directions. Here are some tips to save money on emergency care. Emergency rooms are for serious conditions. Instead of going to the ER next time, take a few moments to consider an urgent care facility or retail walk-in clinic that are located inside many pharmacies. It will save you time and money. Take time now to find an urgent care facility in your area so that you will know where to go next time you need care. Another resource for you is NurseLine. The phone number is located on the back of your ID card. NurseLine is open 24/7. You will be able to actually talk to a nurse anytime, day or night, and on weekends. Perhaps you have a sick child with a fever. Do you go to the ER, or can you wait until the doctor's office is open in the morning? The nurse will help you decide what is best for you and your child. Please take advantage of this great benefit. You can register at www.umr.com. You will be able to see your claims and those of your dependents. You can print an explanation of benefits, or EOB, in case you have misplaced the one you got in the mail. You can order new ID cards and also print a temporary one until the new one arrives in the mail. There are also health and wellness tools on the website to help you with weight loss, exercise programs, etc. If you are currently enrolled in the base, HPP, PPO, or minimum plans and are not making any changes, you will not be issued a new ID card. New cards will only be issued to team members who are newly enrolling or changing plans. You can always request an ID card online or by contacting UMR customer service. Flexible spending accounts are offered for both health and dependent care through our vendor TASC. With a health FSA, you are able to contribute up to $26.50 annually. This has increased $50 this year to pay for medical, dental, and vision expenses with pre-tax dollars. With a dependent care FSA, you can contribute up to $5,000 annually to pay for dependent care services expenses with pre-tax dollars. The benefit is offered to full-time team members who are satisfied 1 year of employment and is effective in June each year. Why should you participate in an FSA? Setting aside pre-tax money when contributing through payroll deductions reduces your taxable gross income. You increase your take-home pay using these pre-tax dollars for health care and/or dependent care expenses. The average tax savings is 30% on contributions to FSAs. Please be conservative in making your election for FSAs. Any unused funds left in your healthcare or dependent care FSA at the close of your grace period, which is August 15th of next year, are not refundable to you. The grace period means you are given an additional 2.5 months to incur new expenses with prior plan year funds. At the end of the grace period, August 15th, all unspent funds must be forfeited according to IRS guidelines. You will have 90 days after the plan year ends to submit document care claims that were incurred during the prior plan year. How much should you contribute? Add up all of the out-of-pocket expenses you had last year. This includes copays, deductible, coinsurance, prescriptions, dental, vision, any child or elder care, and voluntary health policies not payroll deducted. This amount will help you estimate your out-of-pocket expenses for this plan year. You may contribute up to $2,650 for the healthcare FSA and $5,000 toward a dependent care FSA if you're married and filing jointly. The total contributions between both spouses cannot exceed $5,000. The dependent care expenses provided during a calendar year cannot exceed $5,000 a year. In the case of a separate return by a married individual, the limit is $2,500. This amount may be less if the employee's earned income or spouse's earned income is less than $5,000. This slide gives you an example of the savings when you contribute to an FSA, either by contributing to a health and dependent care FSA or just one or the other. What you contribute affects the amount of savings you will see. Again, you are urged to take precautionary steps when determining what you will contribute and track accounts balances on the Flex System website and/or using the interactive voice response system to avoid having funds remaining in your account at the end of the plan year, because the FSA funds do not roll over. Here are some examples of eligible and ineligible expenses for healthcare. See IRS Publication 503 for a complete list. Here are some examples of eligible and ineligible expenses for dependent care. Again, see IRS Publication 503 for a complete list. You will receive the TASC Smart Card upon plan enrollment mailed to your home. It acts as a debit card and will come preloaded with the amount of your annual contribution for your healthcare FSA. The TASC card will also work for your dependent care FSA, but only with the available account balance. This will provide direct payment while at your provider when swiped from your FSA based on the balance on the card. Using the card eliminates out-of-pocket purchases and reimbursements for eligible healthcare expenses and eligible dependent care expenses. You will be provided with one additional card for a dependent or spouse at no charge. Additional TASC card features means no claim forms to complete. The TASC card cannot be used for expenses incurred in the prior plan year, and the TASC card does not expire for 4 years. Make sure you keep your receipts if you are requested to substantiate the claims. My TASC has a free downloadable mobile app where you can review real-time account balances and request reimbursement for your expenses. It's also a great resource to view your plan, contributions, and transactions. You can also get text messages from your accounts. Understanding Medicare when you are working and over 65 can be a challenge, and Westgate has partnered with Transitions to help you with your options. For team members and/or spouses who are 65 and older, Medicare can be an appealing alternative to group insurance, but there are a lot of questions. How does Medicare affect me or my spouse when I'm still working? When do I enroll? How does it compare against the plans offered through Westgate? Many of your current doctors also accept Medicare, and you have the choice of many different insurance carriers. The deductible, coinsurance, and your OOP maximums can be far less than the current UMR plans. Prescription copays can be less as well. Our partner Transitions is offering educational webinars on the first and third Friday of every month at 2 p.m. Eastern Standard Time. There will be a Q&A session at the end of the presentation, along with instructions on how to set up an individual session with your advisor. This is at no cost to you, and you are under no obligation to move to Medicare. They are simply here to help you with your questions and educate you on your options. Westgate Resorts will continue to offer the same 2 dental plans with Delta Dental, a DHMO in Florida, Texas, and Nevada only, with no deductibles, coinsurance, annual, or lifetime limits. It includes 1 cleaning per 6-month period. This plan has a schedule of benefits with predetermined copays. Out-of-pocket costs are clearly defined. You must receive care from a Delta Care dentist in-network only. Orthodontia coverage is available for children and adults. You must select a dentist during online enrollment. If you wish to change at any time, call customer service. Also, a PPO plan that's available nationwide, which has in and out of network benefits, but staying in network is the best value. Deductibles, coinsurance, and annual limits may apply. It includes 2 cleanings in a 12-month period. You are able to stay with your current dentist even if he is not participating and still receive benefits out of network. Orthodontic coverage is available for dependent children to age 19 only. Dental implants are covered. As previously stated, with this plan, you are responsible for copays when receiving services. There are no deductibles or coinsurance amounts. There is a schedule of covered benefits and copays associated with each service. As an example, depending on the type of crown needed, which would fall under major care, your copay will range between $195 and $355. You can find out what the cost will be prior to having any dental work done. You may refer to the DHMO schedule within the PS library. The dental HMO provides dental benefits through a network. It is important to understand that there is no out-of-network reimbursement. To receive the benefit from this plan, you must make sure you visit a dentist who is in the plan. Please make sure there is an in-network dentist available in your area before enrolling in the DHMO. Again, this plan is not available in all areas. During your online enrollment, you will have access to the dental directory. You will need to choose a DeltaCare DHMO dentist at the time of enrollment. If you do not select a dentist, one will be assigned to you based on your zip code. Additional information on how to look up a network provider is available within PlanSource. The DPO plan is available nationwide. You will notice that the benefit percentage is the same in and out of network. However, staying in network is the best value as your percentage is based on the discounted rate. Whereas going out of network to a non-Delta dentist, they may balance bill you for amounts not approved by Delta or over what Delta will pay. Deductibles do apply for basic and major services, $75 per person or $225 per family. The coverage is 100% for preventative, which includes cleanings. Please make sure to take advantage of the 2 cleanings in a 12-month period with this plan. It's 80% covered for basic, which is fillings, extractions, endodontics, and periodontics, and 50% for major treatments, which would be crowns and dentures. There is a $1,500 annual limit per person per calendar year. You are able to stay with your current dentist, even if they are not participating, and still receive benefits out of network. But be aware that the dentist could balance bill you. Orthodontic coverage is available for dependent children to age 19 only. Dental implants are also covered on this plan. Within the dental PPO or DPO plan, there are 2 different networks to choose from, in-network, or you can go out of network. In-network dentists have a contract with Delta, which provides reduced fees to members, no balance billing, and no claim forms. Delta also offers a unique secondary in-network group of providers, which is the Delta Premier Network. This network is larger than the dental PPO. 80% of dentists nationwide participate in this network. Refer to the bullets in the second box. Or, members can visit out-of-network dentists, but they will be responsible for any fees beyond reasonable and customary charges and could be asked to pay the entire fee at the time of service. Refer to the bullets in the third box. When viewing the online directory, you can specifically select the system to pull a list of PPO or Premier dentists so you're able to see all of your options. Here is a side-by-side comparison of the DHMO versus the DPO for your reference. This is also located in the Benefits Highlights booklet. As already communicated to you, and for your reference, here are the bi-weekly team member contributions. The premiums for dental have stayed the same this year as last year. For your reference, here are the weekly contributions. VSP's Vision Plan is to assist you with vision care expenses by providing both an eye examination and materials, which is lenses and frames or contact lenses. The VSP Vision Plan network is called Choice. VSP is now affiliated with Costco Optical, Eye Care Centers of America, and other high-quality retail chains. There is no increase in premiums. To find a VSP doctor or retail chain affiliate, visit vsp.com or call 800-877-7195. The Vision benefit gives you the freedom to select either an in- or out-of-network provider and still have coverage, although I recommend going in-network to receive the most from this coverage. You may receive one eye exam and one pair of prescription glasses or contacts every 12 months. The plan has copays and a maximum allowance for frames and contact lenses as mentioned. The frame allowance is $150. This plan offers a select set of eye care services for members diagnosed with type 1 diabetes with an additional $20 copay. Westgate Resorts offers life and disability benefits through Mutual of Omaha, to include basic life and accidental death and dismemberment, voluntary life and accidental death and dismemberment, voluntary short-term disability, core long-term disability, and voluntary buy-up long-term disability. Westgate Resorts covers the cost of basic life and accidental death and dismemberment for both full-time hourly and salaried team members. Full-time members will be automatically enrolled in the appropriate coverage level. You are required to designate a beneficiary online through PlanSource. This can be changed at any time. Voluntary employee life coverage is available in $10,000 increments up to the lesser of $500,000 or 7 times your annual earnings. Spouse voluntary life coverage is available in $5,000 increments up to a lesser of 50% of the employee-elected coverage up to $250,000. Child voluntary life coverage is available in 2 options, $5,000 or $10,000 amounts, regardless of the number of children. The employee must have selected at least $10,000 life and AD&D coverage is offered together. Beneficiary designations can be updated while enrolling online. Evidence of insurability is required for new elections outside of the initial new hire eligibility. The voluntary short-term disability plan replaces 60% of your pre-disability base salary up to a maximum weekly benefit of $2,000 should you become sick or experience a non-work-related injury. Benefits begin on the 15th day of your accident or illness. Maternity coverage is included. Benefits can continue up to a maximum of 24 weeks. Keep in mind, there is a 3-month look-back period from the time you elect coverage. That means, for example, if you are currently being treated for a medical condition and you choose short-term disability during this open enrollment, this condition will not be covered for 6 months. Evidence of insurability is not required during open enrollment for new elections, but is required at any other time. With long-term disability, the core plan is company paid and protects your loss of pay when you are sick or injured and unable to work for a non-job-related injury. You are automatically enrolled if you are enrolled in one of the UMR medical plans through Westgate. Your benefit is equivalent to 40% of your before-tax monthly earnings, not to exceed $7,000 monthly. The 3-month look-back means if you have been treated for any medical condition 3 months prior to coverage, that medical condition will not be covered for 12 months. This would not apply if you have elected voluntary STDs. There will be a 180-day elimination or waiting period before receiving this benefit. The transition from voluntary short-term to long-term disability benefits will be coordinated through Mutual of Omaha and your doctor's office. This is a benefit that most team members overlook. Something to consider is, can you afford to live on 40% of your salary if disabled? If not, take advantage of this additional coverage. You may elect extra coverage, an additional 20%, so up to 60% of your income up to the monthly maximum of $10,000 for a low cost. If you are selecting this buy-up option at a time other than your initial eligibility, evidence of insurability forms will be required. EOI is proof of good health prior to enrolling. Coverage is not available until your EOI is approved by Mutual of Omaha. The Voluntary Accident Plan is now being offered from Voya. The purpose of this policy is to cover off-the-job accidents and injuries. There is a listing of specific injuries and accidents that are covered and what the benefit amount will be for that specific injury or accident. The accident insurance pays directly to you regardless of other insurance that you may have, such as medical, auto, or short-term disability. Also, you do not need to be enrolled in UMR's medical plan. It is available to you and your family. Important to note is that the wellness rider that is part of this plan, which will pay directly to you $150 when certain wellness-related tests are performed. What this means is that you and your covered spouse can receive a benefit of $150 for certain wellness-related tests. For example, when you have routine physicals, mammograms, or a colonoscopy, among other tests that are listed in the accident insurance brochure, you and your covered spouse can each receive the $150 benefit. No evidence of insurability if you are electing this past your initial eligibility. The benefit resets each calendar year. The wellness benefit encourages wellness-related tests and rewards those employees that take the time to get those tests done. You will receive a packet of information once enrolled that will explain how to file a claim. Here is the schedule of benefits for specific fractures and dislocations and the flat dollar amount Voya will pay you after an accident. An open reduction means the wound requires surgery. A closed reduction means the wound does not require any surgery. The Voluntary Critical Illness Plan from Voya pays a lump sum benefit if you are diagnosed with a covered illness or condition. Critical illness insurance is a limited benefit policy. It is not health insurance. Features of critical illness insurance include no medical questions or tests required for coverage. It is a guaranteed issue. You can use the benefit money for any purpose you like. Premiums are paid through convenient payroll deductions. This plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are Pap tests, serum cholesterol test for HDL and LDL levels, mammography, colonoscopy, and stress tests on bicycles or treadmills. The annual benefit is $50 for completing a health screening test. If your spouse and or children are covered for critical illness insurance, they are also covered by the wellness benefit. Your spouse's benefit amount is also $50. The benefit for child coverage is 50% of your coverage, with an annual maximum of $100 for children's benefits. Critical illness insurance can help you when you are diagnosed with one of the covered illness or conditions listed here. Some examples would be medical expenses such as deductibles and copays, child care, home health care costs, mortgage payments, rent, and home maintenance. Premiums are based on your age and tobacco status and can be viewed when enrolling online in PlanSource. Further details are also included in the benefit highlights and summary plan description and in the PlanSource library. The Customer Advocate Center is a free benefit to you and any covered dependents enrolled in any of the Westgate Resorts benefit plans. Contact the center via phone, fax, or email as listed on this slide. The final benefit I'd like to mention is the Employee Assistance Plan, or EAP. The EAP is available to team members and members of their households. You do not have to be enrolled in any of the benefit plans to take advantage of the EAP. EAP provides a variety of services that will support your work-life balance. Referrals and information for family care, including, but not limited to, child, elder, and special needs care. Members of the EAP are eligible for 3 face-to-face licensed counseling sessions. You can also visit the Online Education and Resource Center to find information on topics ranging from healthy meal planning to parenting to getting organized and setting goals. Just about any topic you can think of related to behavioral health and well-being can be found in the EAP Online Resource Center. As you are aware, online enrollment is done by accessing PlanSource. All passwords have been reset for open enrollment. To review briefly, you will log in to benefits.plansource.com. Your user ID is a combination of the letters WG and your 5-digit employee number, example WG00234. Passwords have been reset to your date of birth in the following format: your 4-digit year, the 2-digit month, and the 2-digit day. Once you log in with this default password, you will be prompted to create a new password. You will notice the PlanSource site has a new look this year. It is important to point out that you should verify all data is accurate when accessing the system: name, address, dependents, dates of birth, social security numbers, and the current plan elections. Click on Get Started to begin and shop for your benefits. The system will require you to add or include beneficiaries in order to proceed. You must click the Checkout button at the bottom of the enrollment page in order to lock in your elections. Otherwise, your updates will not be applied. Benefit plan and life event information are located in the Documents section, including this presentation, the Open Enrollment Memo, and the benefits highlights and summary plan description, along with required notices. All of these can be accessed at any time, not only during your annual open enrollment. Important reminders: if you are electing medical coverage, you will need to log into PlanSource to answer the tobacco affidavit question. Failure to answer this question will result in the higher non-wellness premiums being applied beginning 6/1/18. If you are covering a spouse, you will need to log into PlanSource to answer the spousal surcharge question about your spouse's alternative medical insurance coverage. Even if you answered this question last year and nothing has changed, it is critical to ensure that your beneficiaries are always up to date. Go online to review all your data: name, address, dependents, dates of birth, social security number, and current plan elections. Then review further detailed benefit summaries and new deductions that apply to you. Determine if you need to make changes. If you wish to add, drop, or change coverage, you must do so by going online no later than Sunday, May 13th, 2018. This concludes the presentation for open enrollment. Any questions can be mailed to benefits@wgresorts.com. Thank you for your time.